Hello, my name is Angana Fofandi, and I'm a student at University of North Georgia, and I'm going to talk about androgens and anti-androgens. So if we look at the androgens, the testosterone is the primary androgens in male, and it is used to treat hypogonadism in male, male climacteric, and also in the treatment of cancer and HIV patient. It is also used in women to treat osteoporosis and loss of libido, also in refractory anemia and endometriosis. If we look at the functions of androgens, it is the main growth hormone. Like in the male, it mainly it helps in the growth and maturation. Also, maturation of male sex organ and secondary sexual characteristic. It is responsible for the facial hair growth and change in the voice in the in the boys during the mature puberty. It is also important in the skeletal linear growth of bones, activation of sebaceous glands, and formation of acne. It has also small role in erythropoiesis production and erythrocyte production, and of course in the role of libido. Now, androgens are scheduled drugs, and it does require a DEA number on the prescription, which this is a new information for me. If we look at the pharmacodynamic, testosterone is mainly produced by Leydig cell in testis in male, and in female, it is produced in ovaries and adrenal gland. It is mainly testosterone. It's released in its original form, and it is converted into dihydroxytestosterone. That's the active hormone in skin, prostate gland, in seminal vesicle, and in epididymis. It has a major effect in protein metabolism, and that's why it's responsible for growth and maintenance. If we look at the pharmacokinetic of androgens, uh, testosterone is available in various forms, in oral pills, buccal preparations, intramuscular, transdermal, and subcutaneous pellet. The oral preparation are very convenient and cost effective as well. The buccal preparation has a longer half-life of the hormone. Intramuscular, it's not that convenient, and it also has a different rate of absorption. Transdermal is very convenient. It comes in the form of gel and patch, and it has to be applied in a different areas every time, the patch especially, and it does have a constant rate of absorption. The only risk factor, the precaution need to take is take care while using patch or gel is not to come in contact with the pregnant women. Subcutaneous pellet, they are also convenient, but it needs a special technique for administration. It is metabolized by CYP450 subtype enzyme in liver and excreted in urine and feces. As like we know that drugs which is metabolized by CYP450 enzyme, it has a many drug interaction, same as androgens also has interaction with warfarin, anticoagulant, diabetic agent, and corticosteroids. It increases the effect of anticoagulant and increases risk of bleeding. It also decreases blood sugar when it's used with diabetic agents, and it increases the risk of hypoglycemia. So needs to pay close attention and monitoring of those patients. If we look at the contraindication and precautions, it is contraindicated if patient has a history of cancer, like a breast cancer in male and prostate cancer. It is pregnancy category X drug, so the patient using gel and patch should not come in contact with pregnant women, and they should use wash their hands before and after. Do not use during lactation, and also be cautious while using in heart failure patient, because it can do fluid retention and edema. Monitoring wise, the liver function should be monitored. Also, the liver and blood count should be monitored on regular basis. And male patients must have a prostate exam before starting androgens and while taking androgen as a prescription medication. Adverse effect wise, it has a life-threatening effect on liver, like hepatocellular carcinoma, hepatitis, and jaundice. Male can also develop gynecomastia, infertility, acne, or baldness. If you look at the other side effect, it decreases the libido, also causes depression. So those patients needs to be closely monitored for depression, any effect of depression. Also changes in urination, because that's why the prostate exam should be done before and during the maintenance dosage. Male can also develop priapism. Women, they can have an irregular menstrual cycle, and increases the bleeding, and it also have effect on the clotting factor. It can suppress the clotting effect. And there is a other life-threatening effect is paleo-hepatitis. In that particular disease, there is a bloody cyst formation in the liver, and which can be very dangerous for the patient. So those patients needs to be monitored closely. Patient education wise, patient needs to be educated about the adverse side effect, especially on the liver. If there is any nausea, vomiting, jaundice, or anorexia, they need to tell their primary care provider about that. Also take medication on time as prescribed. Wash your hands after using gel or patch, and stay away from the pregnant women. Monitor the kidney test, the kidney function and the liver function, and also the voiding pattern. Make sure there is no side effect on prostate gland. Elderly should have, they should monitor their salt intake and any fluid retention or edema. If you look at the anti-androgen, the commonly used anti-androgen is Proscar finasteride. It inhibits the 5-alpha reductase and enzyme and blocks the conversion of testosterone to dihydrotestosterone. It is mainly used in benign prostatic hypertrophy and baldness, and it is metabolized in liver and excreted by kidneys and in feces. It has an adverse effect of decrease in libido and impotency. There are other anti-androgens are Lupron and spironolactone. Lupron is an LH that's luteinizing hormone releasing agonist, and it's mainly used in advanced prostatic cancer. Spironolactone, as we're already aware, that is an antidiuretic. It is potassium sparing, and it acts on the 5-alpha reductase enzyme. It inhibits it, and also the aldosterone. It has also small use in excessive hair production. That's hirsutism. And that's all about the androgen. Thank you for listening.